So, weight gain is a symptom, not a disease. Let's take a look at diet culture for a hot minute. 91% of college women have attempted to control their weight through dieting. 91%. 22% said that they dieted often or always. The weight loss or obesity industry, which consists of commercial weight loss programs, weight loss drug manufacturers, and bariatric surgery centers, make about $315 billion a year. This is nearly 3% of the entire US economy. And we have to ask, are all these efforts working? 95% of people who lose weight through dieting gain it all back and more in the next 1 to 5 years. 75% of American women feel shame and unhappiness towards their bodies. And childhood obesity has tripled since the 1980s when America first proclaimed a war on obesity. So, no, diets don't work. And why is that? Well, diets are unsustainable, first of all. And secondly, they don't acknowledge or treat the root cause of weight gain. And more importantly, metabolic dysfunction, which may lead to weight gain. So, Linda Bacon, in her article, Fat is Not a Problem, published in Scientific American, says blaming fatness for heart disease is similar to blaming yellow teeth for lung cancer, rather than considering that smoking might play a role in both. And telling people they need to lose weight is a lot like telling someone with a cold to stop sneezing so much. It may not be possible and it won't make the cold go away. An Atlantic article titled How Obesity Became a Disease outlines the controversy of how obesity became a disease. So, a committee charged by the American Medical Association, the AMA, who recommend obesity not be qualified as a disease, laid out these arguments. They firstly said obesity has no symptoms in and of itself. Remember, your body considers fat to be all those things we talked about in the introduction or in the last lesson. In fact, it is only a symptom of an underlying cause, mostly metabolic dysfunction. Secondly, obesity is not always harmful. Remember from the JAMA article that in most cases it can be actually protective, resulting in a reduced risk of all-cause mortality, especially for people with chronic degenerative diseases like cancer. Secondly, the committee continued, disease means that something in the body has gone wrong, ultimately. However, fat gain is the result of a normal adaptation to a specific environmental circumstance, famine. And our bodies that tend to gain fat aren't diseased. They are merely expressing what was once an evolutionary advantage to protect them from times of scarcity. This is why people who are more prone to weight gain and obesity have passed these genes on through generations because those genes were advantageous during much of human history. We say in nutritional genomics that genes load the gun and environment pulls the trigger. And so obesity or unwanted fat gain, let's say, is an environmental, so in essence, socioeconomic, biopsychosocial phenomena, not a disease. So lastly, the committee said, it was concerned that making obesity a disease would further stigmatize it and thereby hurt patients and expose them to treatments aimed at correcting what was actually a very normal biological response to abnormal environmental circumstances. And obviously, the committee was overruled because obesity is now considered a disease. And we know now that the treatments have been numerous, and they have included things like psychosurgery, which is a process that involved burning lesions into a region of the brain called the hypothalamus. Obviously didn't turn out well. Jaw wiring, which was popular in the 1970s and 1980s, which obviously stops working once you take the wires off and start eating again. Pathologizing appetite with medications like appetite suppressants, bariatric surgeries, and of course, the very common gold standard treatment for weight gain and obesity, the reduced calorie diet. Calories in, calories out. It's a simple scientific equation, right? It's the law of thermodynamics. However, it fails to recognize one important thing, our metabolism. In order to balance the CICO, calories in, calories out, equation, we need to solve for factor X, which is our metabolic rate and efficiency, i.e., how the body stores and utilizes energy, and how that metabolic rate declines in the presence or absence of calories. And sequel diets don't do this. In fact, reduced calorie diets, fasting, and other methods of reducing energy and food intake and increasing energy expenditure further damage the metabolism. And you may know this, that maybe why you're taking this course, or maybe you're just curious, but you may have tried a diet before, and you may have experienced the following: guilt and shame about not being able to follow the diet. Being able to follow the diet at first or for a while, and then inevitably falling off, i.e., going back to eating carbs or pizza or whatever else was off limits during the diet phase. Doing everything right and still not losing weight, perhaps after an initial weight loss at the beginning of the diet. Repeating a diet that worked in the past that eventually failed, only to find it no longer works this time around. Feeling drained, fatigue, low motivation, cranky, irritable, experiencing low libido, hair loss, change to hormonal functioning, or even missed periods, changes to skin texture and quality, etc., 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 all of which indicate changes to your metabolism. And you also likely experience slowing of your metabolism. And the big indicators of a slow metabolism are low energy, increased cravings, and hunger. However, there is a more extensive list. I'm just going to go through it right now. So, digestive issues, gas and bloating, constipation and or diarrhea, reflux, heartburn, fatigue after eating, i.e. like less digestive efficiency, low energy, fatigue, increased hunger and food cravings, reduced libido is a big one. Edema, fluid retention, especially in the calves or ankles, anxiety and depression, irritability, rage, loss of patience, weight gain or difficulty losing weight, loss of muscle mass experienced by decreased strength and or stamina, irregularity or cessation of periods in women. Periods become lighter, they become irregular, they become heavier, more painful, or absent completely. Infertility, no motivation for exercise and poor exercise recovery. Changes to skin, dry skin, acne or rash prone skin. Signs of accelerated skin aging like dullness or wrinkles. Hair loss, split ends, brittle and dry hair. Feeling cold all the time, poor circulation, low immunity, recurring and or prolonged colds and flus, sleep disturbances, waking in the middle of the night, not feeling rested in the morning. I feel like I'm in one of those drug commercials that I'm listing all the side effects. So these are all the side effects of low-calorie dieting. Add on the stigma, the food shame, the body image issues, and the confusion around our health and what actually causes unwanted weight gain, and we have a massive recipe for disaster. However, I also want to point out here that my goal is not necessarily to convince you to just be happy with your weight and move on. I mean, I'd love for that to be you, and that might be you, and that may be where you are in your journey. Really, especially considering the HAES Health at Every Size movement. But I actually, more specifically, my goal as a naturopathic doctor is to get people to be healthy. And this means to be happy with your body at the shape it takes on when you're in your optimal state of mental, emotional, and physical well-being. I have lots of stories about this in my practice. I have a patient who struggles with obesity who takes issue with the Health at Every Size movement just because she feels like her weight is negatively contributing to her health. But then on the other hand, you have people that want to take stigma off their weight and not hear from every medical practitioner that they talk to that weight is the cause of all their issues. So I have a story that occurred early on in my clinical practice that makes me think a little bit differently about weight gain and patients' weight loss goals. I have a patient in her 50s, and she would come in and she would complain about weight gain. She would say things like, "Look at my thighs," and she would exclaim this, and I would look down at my own thighs and wonder if she noticed that my thighs were like twice the size of hers. And so I sort of chalked up her case to her own body image issues and tried to kind of discourage her subliminally from focusing on weight and turning the topic back to her health. But then her blood work came back, and her estradiol, her estrogen levels, were way over range, which is very uncommon. She was struggling with alcohol addiction And we were both concerned about her liver health. And estrogen is processed through the liver, and elevated estrogen, among other things, can be a side effect of poor liver hormone metabolism. And weight gain in the lower body, thighs, and buttocks, especially beyond what you're used to for your body, can be a symptom of elevated estrogen levels because estrogen tends to store fat in those areas. And so when I put that all together, I realized that this patient in her distress was not just getting down on her body, and she wasn't just being shallow about things. She was actually trying to communicate something important. She wasn't necessarily communicating, I hate my body when I look in the mirror, and maybe she kind of was, but a little bit, but she was also expressing something feels wrong in my body and I don't have the words to articulate it, but I've noticed that my thighs feel heavier and boggier and bigger, and I'm just going to say fatter because that is the symptom I'm able to describe. And so now I pay attention and honor this feeling of I just don't feel like myself that people will say, right? It's not just so much about like, oh, just be happy with your body. I mean, be happy with your body, but also take that feeling. You can definitely use that feeling that you just don't feel like yourself as a symptom of something that might be going on. And so I try to help patients move beyond the aesthetic experience of their bodies, like what it looks like, whether you're ready for bikini season, etc., to actually help them articulate what might be going on and what they actually feel. And we work on viewing fat gain as a symptom of an underlying imbalance that warrants our attention. So, what do we actually want to say when we say that we want to lose weight? We usually mean we want abundant energy, a strong libido, lush and healthy looking skin and hair. We want more physical strength, stamina, and flexibility. We want to be in a good mood most of the time. We want strong digestion. We want to feel patience and a sense of inner peace. We want healthy periods or freedom from perimenopausal or menopausal symptoms. We want to feel motivated and productive. And the problem with low calorie dieting, and when I say low calorie dieting, I'm referring to even a 500 calorie deficit, like just any sort of like lose 1 pound a week type weight loss diet, which is pretty standard. The problem with that is that because of its effects on metabolism and the root cause of weight gain, we actually experience a worsening of all these symptoms. And that is why the mantra should be get healthy to lose weight, not lose weight to get healthy, unless the actions that lead to weight loss are addressing the real root cause, in which case you're getting healthy to lose weight. The root cause can be hormonal or metabolic. It can be a sign of nutrient deficiencies or toxicities, impairments of the organs of elimination. It may be a sign of inflammation, chronic stress, or sleep issues. And it's my job as the naturopath to do the detective work and uncover the cause. And this can take time and involves a more in-depth intake. However, I created this course because there are some universal standards, and we'll go through some of these causes here in this course. And so again, I'm going to say it again, this course is not meant to be a complete diagnosis and treatment, but it will hopefully help you move beyond the SICO/weight gain as disease model and start to help you look at what pieces of this puzzle resonate. Perhaps this will lead you on a road where you employ some professional or other resources to help guide you further down the path of optimal health, nutrition that nurtures your body and body acceptance.